Yes, Dr. Shah. Sir, please.
All right. Thank you, Nimitza. Good morning, good afternoon, everyone, according to your time zone. Welcome to DARE-RC's 7th webinar titled Advancing Disability Inclusive Education in Pakistan, Local and International Perspectives. This webinar is part of the DARE-RC series on building communities of practice in education. I'm Dr. Sahar Shah, and I will be your moderator today. I'm the Senior Research Manager at DARE-RC. DARE-RC is an FCDO-funded project. It is an education research program implemented by Oxford Policy Management in partnership with the Aga Khan University Institute for Educational Development and Site Savers. It is dedicated to enhancing Pakistan's education system through high-quality research and promoting evidence-based policymaking. Before we begin, I would like to share some ground rules. You may use the active chat box to share your comments and queries respectfully with our presenters. We will have a dedicated question and answer session towards the end of the webinar. And also, we will be sharing a QR code that leads us to a feedback form. Please don't forget to share your feedback with us towards the end of the webinar. Now, let me begin with a simple but uncomfortable question. How many children with disabilities are currently in Pakistan's schools, and how many are missing from them entirely? The reality is that we do not have a clear answer, and that in itself is part of the problem. Across Pakistan, children with disabilities face layered challenges, not only in accessing education, but in being recognized, supported, and meaningfully included once they enter the education system. The good news is that there is a growing body of research, much of it produced locally, that offers important insights into these challenges. Yet too often this evidence remains fragmented, underutilized, or disconnected from policy and practice. Today's webinar attempts to bridge that gap. We bring together 5 DARE-RC supported studies that examine disability from different but complementary angles, from how we identify and measure disability, to how children actually experience schooling, to how systems respond to crisis and climate vulnerability, and how innovations like assistive technology can reshape inclusion. Let me now introduce our distinguished speakers who have taken out their time to share their insights, valuable insights with us. We have with us Dr. Julia Decat. Dr. Julia, thank you for joining in. Dr. Julia is the head of portfolio for health and disability research at Site Savers, whose work focuses on disability inclusive education systems and the experiences of children with disabilities across Africa and Asia. We also have with us Mr. Ittifaq Khalik Khan. Thank you so much for joining us. Mr. Khalik is an inclusive education specialist with 15 years of experience. He focuses on data systems, teacher development, and accessible assessments, and currently serves as a global technical lead at Site Savers, supporting programs across Asia and Africa. We have with us Dr. Sapana Basnett. Thank you for joining in, Dr. Sapana. Dr. Sapana is a social scientist and senior research associate at Site Savers, specializing in inclusive development, climate resilience, and health systems. She has led multi-country research across Asia and Africa and supports governments and global partners with policy-relevant, community-focused work. We also have with us Dr. Nasima Shakil. Dr. Nasima, thank you for joining us today, who is an assistant professor at Aga Khan University and an early childhood education specialist with over 15 years of experience. Her work focuses on play-based and inclusive learning, addressing gender, neurodiversity, and equity. She is currently a co-principal investigator with Site Savers on inclusive education research. We have with us Dr. Sana Shams. Dr. Sana Shams, I hope she has joined us. Thank you for joining us. Dr. Sana Shams has over 20 years of experience, and she has contributed to numerous national and international initiatives spanning natural language processing, AI-driven technology development, and research commercialization for languages of Pakistan and the developing world. We are highly honored to have with us Dr. Professor Nidhi Singhal from the University of Cambridge. Thank you so much for joining us, Dr. Nidhi. Dr. Nidhi is a global authority on inclusive education whose research explores inclusion and exclusion in education systems, particularly in South Asia and Sub-Saharan Africa. And she also leads an international research network in this field under the name of Candor. Next, we have with us Ms. Ujala Sarfaraz. Ms. Ujala brings extensive experience in disability inclusion and policy engagement, particularly in the South Asian context. She brings massive experience from working in public health, programming, climate change, and government engagements. And finally, we have with us Mr. Mohammed Atif Sheikh, and we'll hear from him regarding his lived experiences. He's a senior disability inclusion expert with over 20 years of experience, currently serving as executive director of STEP Pakistan. He is a representative of the Organization of Persons with Disabilities, OPD, and has advised major global organizations and the government of Pakistan on disability policy and inclusion. Thank you so much for joining us today. So let's now move on to our next segment, which is our research spotlight segment. First of all, we have with us, there are 5 studies that we're going to cover. The first study being titled Disability Inclusive Data and Systems, Analysis of the Integration of the Washington Group Questions on Disability into the Annual School Census in Pakistan. Mr. Tafaq, thank you for joining, and I'll address the first question to you. Your study focuses on integrating standardized tools like the Washington Group Questions into education data systems. Why is this so critical for Pakistan?
Thank you. Thank you very much, Dr. Sahar. So being the first speaker, let me take this opportunity to appreciate and thank Adair RC for bringing us all together once again for this really important discussion. And this is important because, the children with disabilities in Pakistan are known to be extremely educationally vulnerable. They are, most of them are out of school. And those who are in school are really struggling with their learning outcomes and their educational achievements. For last few years, there has been an increased kind of focus on disability inclusive education in the country, which is reflected in some key policy documents. I will not go into the detail of these policies, but there has been an increased focus on disability inclusion. Nevertheless, the implementation of these policies has always been a challenge and remain at the very early stage. This weak implementation of these policies can be attributed to so many challenges and problems. And the most important of them is basically the lack of reliable quality data on prevalence of disabilities, prevalence and types of disabilities amongst children with disabilities. So this has been a challenge. So, the lack of this data on children with disabilities pose a challenge for a reliable kind of policy which is informed by the data and the informed implementation plan on inclusive education in Pakistan. And that is why, until very recently, the data system in Pakistan are they were not really catering the collection of disability data. And if the data is collected, there was a kind of a variation between the provinces. So there is no standardization set of data on children with disabilities in the country. Now, to address these challenges, the government of Pakistan have very recently have introduced Washington Group short set of questions on disability in the annual school census of 2023-2024, which has been a significant step towards strengthening of the data on children with disabilities. And this, annual school census is a repetitive exercise. It occurs every year, and it also, collects data on a wide range of issues, including disability inclusion from 2023-2024. So now, for those who don't know the Washington Group short set, so this is a standardized tool on collection of disability data on 6 kind of functional domains, and it is very widely used for the surveys in population censuses globally for the collection of disability data. So now, following this integration of disability inclusion in the annual school census, the study that we are presenting has contributed significantly towards the strengthening of disability data, educational data, particularly around children with disabilities in the country, by exploring this integration process, because this was done for the first time in the country. So it was really an important kind of time to explore how this exercise actually went, and what are the challenges and learnings that we can extract from this kind of activity to inform the future annual school census exercises, to inform the educational data, to have a reliable, consistent and quality data on children with disabilities for more kind of informed policy development, and for more informed delivery and development plans on inclusive education. So I will conclude by saying that the data is critically important, because it is not only about numbers, it is actually about the recognition, it is about the visibility, and it is also about the dignity of individuals, particularly children and people with disabilities. And I'll stop here.
Thank you so much for that, Mr. Tafak. This sounds wonderful. Could you also shed light on what gaps currently exist in identifying children with disabilities in schools?
Sure. So thank you very much. This is again a very important question. So the study we conducted in collaboration with Pakistan Institute of Education, which is part of Ministry of Federal Education and Professional Training. The study used the mixed methods, including a comprehensive and secondary quantitative analysis of the data set that was collected as a part of annual school census, as well as the documentary review and the qualitative work with the stakeholders who are involved in this exercise. So I mean, the study doesn't only captures the gaps and challenges. There are so many strengths as well, but keeping your question in mind, I will be discussing some of the gaps that the study have really identified. So the first one is basically the underreporting of prevalence of disabilities. So we found in the study that this prevalence of disabilities and children with disabilities in school was quite underreported. Only one school in every 10 schools have actually reported having a child with disability in that school. So you can imagine that in the school, over 150,000 schools, there are only around 15,000 schools who have reported to have a child with disability in that school. And this has also been acknowledged by some of the stakeholders, some of the schools who have involved in the qualitative work that we done as a part of the study. Another challenge was inconsistent approaches to the data generation. So due to the lack of kind of guidance, school have adopted their own different ways of generating the data for annual school census, and some of the schools have approached it in a way that they have asked directly to the children with disabilities in the schools, in their classes, to disclose their disabilities. Many others have actually have a very careful observation in their classes and schools, and some of them have little or no kind of interaction with the tools at all. So there was an inconsistent approach towards the generation of the data. Another challenge that we had, and a study actually found, is the limited development and use of the training and guidance. I think I should have have this point later in the sequence, because many of the challenges and gaps are really can be attributed to this challenge. There was really limited kind of opportunity of developing and then utilizing the training and guidance material, particularly cascade them to the school level stakeholders. So this has always also been a challenge which has impacted so many other areas as well. There was a limited understanding about the purpose and use of the data, which has really created a frustration among the stakeholder and have also kind of undermined the quality and consistency of the data and the approaches that were used to generate the data. And it also include the lack of kind of limited kind of analysis and sharing of feedback to inform the school level interventions and improve the accountability and decision making at school level. Disability related stigma was another barrier to the reliable generation of the data. So the underlying attitudes and understanding of the disability and functional difficulty at the teacher's part was kind of a challenge that has impacted the generation of quality data on children with disabilities. However, you know, the, the, the disability inclusive ASC was an enormous commitment, because as we just heard, that it was implemented in more than 150,000 schools at national level. So it was a huge commitment. So this kind of challenges were expected, but the important point is that how we learn from these challenges and how we improve the upcoming exercises of annual school census to have a consistent and quality reliable data on children with disabilities. And that definitely needs an iterative process, improvement process, as well as a shift towards learner-centered data that can then inform not only the policy development, but also the practices at the school level to benefit the children with disabilities in class, and to benefit and to improve the quality of inclusive education in the country. I'll stop here, Dr. Sahar.
Thank you so much, Mr. Tafaq, for those valuable insights and making us aware of the issues and challenges. Moving on, we have Dr. Julia, who has also shared a link. The chat box is also working on the first study. But let's come to this particular study titled Classroom, Family and Community-Related Experiences of Children with Disabilities in Mainstream Schools in Pakistan. We will have Dr. Julia and Dr. Nasima responding to questions related to this study. So, Dr. Julia, I'll start with you. Your study directly captures experiences of children with different types of disabilities. What were the most striking patterns that you observed?
Hi, Saha, and thank you very much for the question. So our study made use of qualitative methods to learn about the experiences of children with disabilities attending mainstream government schools in Sindh and KPK provinces in Pakistan. We did this to ensure that the experiences of these children can inform efforts to strengthen the delivery of inclusive education in these provinces in the future. We did find that children with a wide range of disabilities were in fact attending public mainstream schools in the two provinces, although generally in any particular school there were only a small number of children with disabilities. Overall, we found that these children with disabilities and their parents really valued education. However, we also found that their full participation in education was often quite constrained or limited, shaped by the intersection between their individual functional difficulties and the educational context. In particular, we heard from children that they often had strong views and preferences about different teaching practices. And we heard that lecture-based, fast-paced instruction and a lack of differentiation were often experienced as barriers to learning by children, while children felt that appropriate adaptations and more interactive or supportive teaching practices helped them to learn and participate more fully in education. What we did see, though, was that many of the teachers continued to view disability through a medical model lens. So they would describe disabilities as a problem that an individual child would need to do additional work to overcome, rather than considering ways in which learning could be adapted to support that particular child. We heard a lot from children about the physical and environmental conditions of their classrooms and schools. For example, in relation to seating arrangements, classroom temperature, lighting and sanitation, all of these impacting on children's learning and feelings of comfort and well-being at school, particularly among children with mobility or sensory difficulties. Obviously, these factors do impact on all children, but the impact is often amplified for children with disabilities. We also heard from children that many of them experienced various forms of emotional and social exclusion at school, including stigma, isolation from peers, and bullying, all of which affected their confidence and their willingness to participate in class. A second really strong theme was around the quite weak school-family engagement. Parents often reported experiencing quite a lot of stress in relation to their child's schooling and often felt quite unsupported in ensuring that their child was receiving an education, while schools often viewed families as disengaged or uninterested in supporting their child. Communication between teachers and parents was generally very limited. And then finally, we found that parents and children were often quite isolated within their broader communities, which placed additional pressures on them in relation to education. This isolation seemed to be a bit greater in more urban areas, and parents and children often had very weak or no linkages to health and social support services. Children's safety in the community, and particularly during travel to and from school, was also often raised as a concern, particularly by girls and their parents. Thank you.
Thank you so much, Dr. Julia. These are eye-opening insights and very helpful for those who are working in this field. I would move on to Dr. Nasima. Dr. Nasima, if you could explain were there differences across the different types of disabilities, for example, sensory versus intellectual?
Thank you so much, Dr. Sahar, for asking this important question. And thank you, Dr. Julia, for setting the scene for this answer to this question. So yes, Dr. Sahar, our data reveals that there is a clear and important differences in children's experiences, depending on both the type and severity of their disability. For instance, children with sensory and physical impairment often pointed to very practical barriers in the classroom. They often talked about things like seating arrangement in the classroom, whether they could see the blackboard clearly, whether they could hear the teacher's voice or not, or whether they were able to follow the pace of the teaching. So it's important to note that teachers were generally more aware of these visible disabilities among children, but their understanding of how to support these differences were often mixed. And however, children with less visible disabilities or cognitive or learning difficulties faced a very different set of challenges. For example, teachers had limited understanding of learning difficulties due to neurodiversity or cognitive delays. Further, teachers had lower expectations of those children, and in many cases, these difficulties were misinterpreted as lack of efforts or even poor discipline by the child. So data also reveals that because of the misinterpretation, many of these children were required to repeat their grades without receiving the required support they actually needed. And one of the major challenges which we faced during the data collection was related to the communication barriers. Especially, we faced this challenge with the children who had severe hearing or intellectual disabilities. So due to these reasons, we were not always able to fully capture their experiences. but the lack of appropriate support was always very clear in all the cases. And importantly, these differences were not only about disability type. As Dr. Julia already mentioned, that we also saw variation between socioeconomic status of the children, parental education, and gender. For instance, as Dr. Julia mentioned, that children, the girls particularly with disabilities, often faced negative attitude towards their education, and many were even concerned about the safety while traveling to school and back to their home. So, what this tells us is that understanding these layered differences is essential. If we want to improve the inclusion of inclusion of children with learning difficulties or disabilities, we need to address these underlying challenges first. This means that there is an urgent need of strengthening teachers' capacities to support children with disabilities. They also need to address resource constraints to create a stimulating and safe learning environment in the schools. And we also need to reduce stigma and prejudice about children with disabilities, and more importantly, building stronger relationship between families and schools. So thank you so much. I stop here.
Thank you so much for answering this question so comprehensively, Dr. Nasima. For those in the audience who joined us late, do share your questions in the chat box. They will be responded to by the speakers towards the end of the webinar. All right, moving on. We have with us Dr. Sipana, who is working on two very important studies on resilient education system for adolescent learners, inclusive community-based participatory research in Pakistan. And the second study is titled Climate Change Hazards, Risks and Vulnerabilities Assessments in Schools in Pakistan, Piloting a Localized Participatory Assessment. So, Dr. Sipana, you explore resilience from the perspective of adolescents and communities. What does resilience actually look like for children with disabilities?
Thank you, Dr. Sahar, and thank you, previous speakers. I think they set a good scene for me, a good context for me to talk about children with disability and learners with disabilities. My today's answers will be based on both studies we conducted, and we will partner with Allama Iqbal Open University in Pakistan, and I'm sure the rest of the team, Salman, Dr. Zahid, and Dr. Mahmood, are in the list of the participants. So to answer your question, study participants, who also included learners with disabilities, shared that resilience for them is ability to continue learning safely during and post disruptions. And this learning continuity was not just about enrollment to school, which often happen in mainstream schools, but with no dropouts or poor learning outcomes after the disaster impact. For example, many learners with disabilities in mainstream schools often dropped out after a major flooding related disasters because there was no access to schools or no access to the transport to get to school. And then after the dropout, they never returned to school. So for them, learning continuity had to be continuous even after the disaster. It was also about usable access to the routes, which means safer routes to school, to transport, and to classrooms. Some of the classrooms, as adaptation to flooding, the classroom, the door threshold had been raised to block the flood water entering the classroom, which meant that previously accessible classroom for mobility impairment had now become inaccessible. So usable access was more important for them to have a resilient education system. And education is not just about having access to classroom or teachers, it's also about health and well-being, whether you are well enough to get to school and to learn and perform well in exams. So health and well-being had to be, they said, resilient education system where health and well-being needs to be protected. And these examples were shared time and again, like heat, stress, pollution, and mobility needs during flooding were some of the issues that were impacting their health and well-being. resilient education system is not just about the post-disaster or during disaster action, but anticipate and plan for support from teachers and community. So it was about preparedness for learners with disability. And teachers also experienced these heat and pollution, mobility need related issues, and that had to be addressed for teacher and by teacher to ensure that plans and preparedness was in place for learning to continue even during and post-disaster. I'll stop here.
Thank you so much, Dr. Subhana, for sharing these nuances. Moving on, how can schools realistically embed this kind of resilience into everyday practice?
Yeah, next slide, please, Sarah. Thank you. That is a very good question. Given Pakistan's context and given the political and the financial context as well of some of these provinces in Pakistan, it is easy to say this is how, but it is always we can see challenges and implications or implementations. And therefore, we have outlined some clear points where these can be addressed in everyday practices for schools. For example, plan for disruption as normal, not as exceptional or crisis. We know Pakistan is one of the highest in risk of climate change related disasters. We also know, because of the low and middle income setting of the Pakistan and how diverse different provinces are and its socioeconomic status, that there's other social kind of disaster and political disasters as well. So given the frequency of these events, that Pakistan cannot, or Pakistan's education system cannot function as status quo, function as normal. The everyday disaster that they experience need to be now taken as normal and planned for. So that is the first, I think, first option. The next is that schools need to ensure that transports are usable in extreme weather events. School buildings, all infrastructure, education infrastructure, including school buildings and transports, need to be usable in extreme weather, especially heat and humidity, and roads in the same way for during the flooding season and waterlogging season. Also, the timetables of the schools, pedagogy and expectations, so assessment expectations from learners need to be considered and planned for. That needs to be embedded into our everyday practices. For example, Pakistan experiences a school closure during term dates, and these school closures are induced by this climate change related disaster. It also experiences school closure because of the political unrest and social unrest in Pakistan. So if a school closes during term times, then the holiday period needs to be used as teaching time to ensure that they do not lose learning. So, and that needs to be at provincial and district level, not just at the national level. Similarly, the curriculum needs to be often cut short because of these school closure. But learners shared that the examination questionnaire is set by the national level. Therefore, the learning, the curriculum reduction does not reflect the questionnaire, and therefore the learners fail to answer question they haven't learned, and expectations therefore, for examination results is very poor. So that needs to align. Another point is about using community spaces when schools are inaccessible. Our study found that in some of the districts, community came together to continue teaching their children. So teacher who lived in that community or senior elder peers who taught younger children within that community, but they did not know how to teach learners with certain types of disability. In communities where that community level teaching continued, the learning outcomes were reported better. So we know it works in some parts. Therefore, using community spaces when schools are inaccessible is another way of continuing learning, so it can be embedded into everyday practices. Also, maintaining contact and support, re-engagement after absence. Like I said earlier, most of the learners from mainstream school in rural setting dropped out after mainly flooding related disaster and never came back to school. So, and school did not have any mechanism or system in place to maintain that contact and re-engagement. So that should be in place. And focus on continuity, inclusion, and well-being to address all of these issues has to be priority. I'll stop here.
Thank you so much for that, Dr. Sapana. Such important practical observations and solutions. So connected to this, coming to climate risk and disability, this is a very interesting intersection. And why is it important to connect these two areas? And how does your adapted school assessment tool help identify risks, specifically for children with disabilities?
Thank you. Next slide. Thank you. And this connects to the risk assessment we conducted in schools in Pakistan. We know that, and previous speakers have also shared that climate change or climate hazards do not affect everyone equally. Learners with disabilities, and especially women and girls with disabilities, are disproportionately impacted. We also know that children and adolescents with disability face greater health, mobility, and learning risk already. And given the disasters context, those risks exacerbate. Climate blind planning can create new barriers like inaccessible remote learning, inaccessible evacuation, and food protection, and so on. And we've seen the example of that through both our studies. For example, the children or adolescents with severe disabilities were left behind by their parents during flooding because their livelihood and assets had to be prioritized. So the children with severe disability were left behind on their own in the houses where the rest of the family evacuated, and they had to wait for the emergency team to come and evacuate, and often that didn't happen, so they lost lives. So we know that climate blind planning in evacuations and so on does not help. We also know that risk of learning loss and widening inequalities across the globe, the climate change is impacting education system and risk of learning loss and widening inequality led by it. It is also connecting climate risk and disability also essential for equitable climate adaptation, which is a commitment of Paris Agreement, the climate change framework, and also of Sustainable Development Goal 4. So we cannot, and we know no one should be left behind, and no one, leave no one behind. So we cannot ignore the interconnectedness and the impact of it on learners with disability. And that's why it should be important. Thank you. And next slide for your next question, sorry. So your question was around how does the adopted school assessment tool help identify risk for learners with disability or children with disability? I'll briefly talk about the tool. The tool, risk assessment tool we piloted in Pakistan is the same tool as the tool that is in Pakistan's school safety framework. So Pakistan has a school safety framework. That framework is on based on the global comprehensive school safety framework. Pakistan has adopted it and nationalized it. However, the questionnaires within the school safety framework in Pakistan are extensive. It's about 300 questionnaires, and the risk assessment is supposed to be conducted at school level by the team in school, but given the capacity of our schools in Pakistan and given the complicated nature of the school questionnaire and school safety framework, I think there's huge gap in implementation. I think the gap is because of the complexity of the tool. So in Pakistan, we piloted this school safety risk assessment tool which was also piloted by UNESCO and Ministry of Education in Vietnam in 1,000 schools, and it was proven to be very successful, and most of the school adopted that tool and they continue to do it. It is the same tool, but it is the shorter version that we piloted. So this assessment tool, what it does for learners with disability or children with disability is that it goes beyond identifying hazards, and it asks for risk for whom. So it connects, it understands that interconnectedness of the hazards, risk and vulnerability, and it asks for risk for whom and what kind, identifying the risk to all learners and education system. It also assesses climate risk with disability-specific vulnerability, because we know that various types of disabilities, and not all learners with disabilities face vulnerabilities or face hazards in the same way. So risks are identified to disability-specific vulnerabilities. It looks at the capacity at all levels, and that aligns with the disability-specific needs. So the tool that we piloted not just also understands the vulnerability, but it also looks at what capacities do each school and community have in order to minimize or mitigate those risks that they experience. And it also identifies school-level hidden and seasonal risk. We build seasonal calendar within that tool, and that seasonal calendar clearly is able to identify what each individual school, what kind of risk they face, and the learners, types of learners they are in there, and what risk they face. Also, the tool enables anticipatory and targeted action, not reactive fixes. What it means is that tool also has a part where the locals can action plan on the basis of the finding of the assessment. And action planning is also preparing for the next event or next disaster, which means it doesn't just reactively addresses the disaster when it happens or after it happens, but it plans for it and takes anticipatory action in advance. I'll stop here.
Thank you so much, Dr. Sapana, for this information. Really important to know that it exists and is being used in research. I'm sure our audience will be finding it helpful who are working in this field. So from here, we're going to go to our fifth study. Breaking the silence, improving educational access, and technology for deaf learners in Pakistan. Dr. Sana Shams, I hope you have joined us. By now, I will ask, yeah, great. That's great. So your study focuses on developing a sign language platform. What problem are you solving through this study?
Thank you, Dr. Shah. Am I properly audible? Just joined later.
The volume is a bit low. I wonder if
Okay.
you could increase it. Thank you.
Okay. We try to do that. All right. So thank you for the question, which is basically some elaboration required on the speech to sign language platform that we are building. We already know that a large hearing impaired population exists in Pakistan, and the reported numbers, they range between 1 and 10 million individuals. Yet, as our study across Punjab, Sindh, and Gilgit-Baltistan confirms that access to educational content for deaf children in Pakistan, sign language, remains critically limited. This is the gap that our study directly addresses. One of the key findings emerging from our interviews with teachers and parents of deaf children is that most parents of deaf children also do not have a much proficiency in sign language. You can rate that to be a sort of beginner level proficiency, which actually means that the home environment, which should be a child's first support system, becomes a communication barrier instead, isolating children from meaningful learning support at home. So, in this context, through this research, we tried to create a web and mobile platform that converts speech and text-based videos into Pakistan Sign Language. What you see here in the slides is the web interface of where a student accessing curriculum content on states of matter with an embedded Pakistan Sign Language interpreter appearing alongside the video. This is something that makes the same content available to deaf children that hearing children utilize to supplement their learning. So this is basically the idea behind the technology that we are trying to achieve. Currently, this platform covers for the deaf community, there is an essential vocabulary that is first taught to basically the deaf children as well as their family members, because they include functional words like, you know, the basic words of I want to eat, I'm hungry. So this is a list of essential vocabulary. So this platform is composed of those words as a first step, which enables communication. And then we have shortlisted certain curriculum topics from English and science from grade 5 and have integrated PSL versions with it. We envision that with a mobile application that we have also developed as another platform, which is almost similar to that of the web platform, this will help parents as well as students to learn basic essential science vocabulary, and also to be able to watch short videos, save them as their favorites, because we found out that these technology and smartphones were somewhat available in almost every household, and they can be utilized in, you know, practicing the same content at home as well, for independent and self-paced learning, even outside the classroom environments. We have been working closely in this context with two deaf schools in Lahore. And if you have a look at this slide over here, and here it is a visual from a lab at a deaf school. And when we used this technology in their classrooms, the response was overwhelmingly positive. Students engaged enthusiastically, and both teachers and parents strongly supported the initiative. Uh, Summing up, actually, this platform is generally designed to benefit both children and parents equally. And as the data shows, you know, strengthening communication and PSL access at home and school is precisely what drives academic outcomes for deaf children as well. I'll stop here for my first response.
Thank you so much, Dr. Sana. This looks and sounds wonderful. Moving on, your research identifies specific risk and protective factors affecting deaf children's learning and communication. So what were the most significant ones you found across Pakistan? And just for the audience, we are noting your questions and we will be addressing them towards the end of the webinar.
Okay, thank you. This so all these responses that we have collected comes from our collaborative effort by working with schools in Gilgit-Baltistan, in Sindh, and in Punjab. We took a sample from government schools for deaf, specifically in the Punjab area, and certain private institutes as well in both Sindh and Punjab. Overall, the respondents were parents of deaf children, they were teachers, students, and we had conducted interviews and surveys to gather this information. And our findings are both qualitatively rich, and we also statistically validated. And we must note that it covers specific schools here, and to make larger generalizations, they must be validated across a larger population. So this is a disclaimer I would want to identify first. So from the data that we collected, two clear set of factors emerged: the risks that hold deaf children back, and the protective factors that enable them to thrive in terms of their impact on their communication and learning. So this was our specific area in which we were looking at. One of the most significant risks identified by both students and parents alike was that the communication barrier created by limited PSL access at home and school was one of the major risk factors. Children learn signing at school, but they return home to parents who cannot communicate with them in the same language, creating a daily disconnect at a certain level. Compounded by socioeconomic constraints, which become a major barrier from the parent side. The majority of families were low income background and had limited access to devices, resources, and support beyond school. So basically, this feeds directly into the next risk, which was an over reliance on school as the only support system. So when the school was unavailable, the support completely disappears. Students also specifically highlighted social exclusion at certain points where they felt disconnected from peers as deeply affecting their motivation and well-being overall. And cutting across all of this are gender-based barriers, which both groups identify as limiting access to technology and comfortable learning environments. On the other side, the school environment also emerges as the single most powerful protective factor. Statistically, it is the strongest. Through our experiments, we analyzed that it is one of the strongest predictors of perceived academic performance across both the parents and teachers surveyed. Parental involvement and emotional support, even when PSL knowledge is limited, makes a measurable difference. Similarly, teacher support through warm relations and actually visual learning tools consistently improves their outcomes. Crucially, actually, both students and parents showed strong openness to sign language based digital learning. This is not a population we found out was as resistant to technology. However, they were very actively asking for it, and underpinning everything, obviously, is the sign language itself, where children have access to, and communication, learning, and social belonging can all improve. I would like to sum up here that these factors are definitely not just observations, but they were sort of validated through the surveys, and they are also precisely what the platform that we've designed for also addressed. I'll stop here. Thank you.
Thank you so much, Dr. Sana. This is very interesting findings. In fact, all the studies have shared the highlights, interesting highlights. So let's come to our synthesis section with Dr. Nidhi Singhal. Dr. Nidhi, thank you so much for joining us. If you could just turn on your video. Thank you. So the DARE RC studies span a wide range of topics, including disability inclusive data, lived experiences of children with disabilities, resilient education systems, and the use of technology to promote inclusion. Could you shed light on what all of this means for climate resilient, inclusive education in Pakistan?
Many thanks, Sahar. And can I just start by, first of all, thanking all the presenters for such wonderfully rich insights. And what a privilege it has been to hear so many different studies in the field. And as someone who works in the Global South in disability and education, I feel like a child in a sweet shop. So it's busy making lots of different notes of all the fantastic questions, ideas, thoughts that are coming to my mind. So first of all, huge congratulations to DRRC on putting together such a strong portfolio on disability research, and well done to all the researchers. So I was trying to organize my thoughts, Sahar. So regarding your first question, so what does all this mean for climate resilient inclusive education in Pakistan? And I think when I'm listening to all the presentations, what is coming to mind again and again, how climate change acts as a threat multiplier for marginalized groups. So what your work is clearly showing that we cannot treat disability and climate as separate silos. Okay, so if we are really to build truly resilient education systems, then in which where the data systems, infrastructure in relation to school buildings, teaching methods and processes, they must be designed for the most vulnerable children. And why is that? Because the system that works for a child with disability is inherently a system which is more flexible and robust for all children. So that is a really important starting point. So now looking at the presentations and thinking about, so what does it mean for climate resilient inclusive education in Pakistan? There are three things I would like to highlight. One is absolutely the need for strong data systems. And this is what I tend to call the right to be counted. And we have heard presenters like Dr. Sapna talking about the lack of learning continuity. So in an event of a climate disaster, if we don't have standardized data, what it does, it often misses children with disabilities during evacuations or even during school reconstructions. Robust disability disaggregate data allows the government to track these children and make sure that they return in post-disaster scenarios rather than being permanently displaced. And more important, as systems are trying to get more children into schools. So that's my first point. My second point is invest in resilient infrastructure. And again, we had one of the presenters really rightly point out, climate change doesn't affect all children or all people equally. Physical barriers can simply become life-threatening during emergencies. There was a talk about the left behind. I think Dr. Sapna talked about how during evacuation and in emergencies, the ones who are more likely to be left behind are persons with disabilities. So what we need to do is, when true resilience means schools are not just built to withstand floods, but are accessible during them also. And inclusive education in this context must ensure that disaster risk reduction plans are inclusive of accessible evacuation routes and safe zones, especially designed for children with sensory and mobility impairments, as they are most likely to miss out on all this. Finally, and really importantly, I think what came through all the presentations is inclusive education is more than just access. It is what we tend to call, it's about the 3 E's. There's some work we've been doing around the 3 E's, that's entry, engagement, empowerment. Yes, entering, accessing schools is important, but also ensuring that children are engaged in the academic and social curriculum of the school. That's really important. And very importantly, how do we empower them through education for a better life and indeed for better, more resilient, climate positive actions? So climate inclusive, resilient, inclusive education, I think should really focus on these 3 aspects as we move forward.
Thank you so much, Dr. Nidhi, for synthesizing this so beautifully. I could just go on hearing you, but let's go to the next point. Based on global evidence, how does Pakistan's disability research and practice compare internationally, according to you?
Okay, and this was the most exciting bit of it, hearing all this when I was trying to think, okay, what am I going to answer to this question? And I think there's complete direct alignment with the global best practices in the field of disability and education research. And I see the state of research in Pakistan through the DRRC being in a state of very much accelerated transition. And again, people who know me know that I like my 3 points. So I've got 3 points to make here. So how does it align in terms of research practice? So one is there's a fundamental shift, which was really nice to hear in all the presentations about the shift in the underlying research philosophy to a more social model of disability. So I've had the privilege of working in Pakistan for over 2 decades, and it's really nice to see how we are moving away in education research in relation to children with disabilities from a charity-based and a medicalized model to really focusing in the DRRC's portfolio on lived experiences, notions of inclusive systems, where one is engaging with social model. So that was really good to see how these studies have been framed. And it's really important to also see how various intersectionalities were being examined. And this was really nice in relation to type of impairment. What would have been really nice to hear more about is the gendered dimension, which I'm sure they are being explored in the studies, but really did not come across in the presentations. But it's really nice to see intersectionalities coming through. The second one, I think, in relation to the disability research is how one is beginning to see greater alignment with internationally comparable data sets and being part of the wider conversation. So having worked with Pakistani disability data before, there were huge issues on how questions were being asked, how there was undercounting of persons with disabilities. And I think our first speaker, Mr. Khan, did really highlight some of these issues even now, but it's really good to see how by the use of the Washington group questions into different efforts that we're moving from a data poor to a more evidence aligned comparison between children in Pakistan and more globally. Again, in Mr. Khan's presentation, it was really nice to hear moving beyond just introducing these questions. What was really powerful to hear in his presentation was also the talk about training the enumerators. I think that's so important. The conversation seems to stop at, oh, let's introduce the Washington group questions. But he talked about training enumerators. He talked about developing the skills to how the data is going to be analyzed. So that's again a very important thing. How do we analyze the data we're collecting? And very importantly, then how do we use it for policy making? How do we use to communicate what we have found? So it is really powerful to hear that whole cycle of data collection being acknowledged and being developed on. The third aspect, I think, in relation to the research is there's a lot of innovation in understanding the intersectionality between climate, disability, and education. And this is something really exciting for me because that's where my research is going. And it was so interesting to see how within the global context, within the global South, Pakistan, the research emerging from Adair RC is really beginning to position disability as centrally as part of the debates in emergencies and in relation to environmental shock. So I think that's really powerful. In response to your second part of the question, how do practices compare internationally? Not surprisingly, there's some really interesting gaps, which again are not particular just to Pakistan. I mean, the three which I picked up was teacher training. Study 2 clearly noted that how teachers don't feel prepared or are primarily using lecture-based methods. Again, not surprising, a huge issue in many other countries. The second point here in relation to practice was infrastructure. And there was a lot of interesting discussion in one of the presentations about it's not just simply about ramps in schools, but also lack of wash facilities, which again has a very strong gender dimension. And finally, the third point, which really stood out for me in relation to practice, is again focusing on engagement. So going back to my point about moving away from entry to looking at engagement, the word isolation came up in Dr. Sana's presentation and in Dr. Julia's presentation. And they talked about isolation, not just in schools and classrooms, but also in relation to family and parents and society. And I think that's a huge bridge that we have to cross in practice in many countries.
Thank you so much for those reassuring comments and insightful comments as well. And point noted about the gender dimension. Researchers, please do take note. So moving on, are there models from other countries that Pakistan could realistically adapt? I'll just change the slide. Yeah.
Yeah, thank you so much, Sahar. Yeah, because when I saw this question from you, I was like, oh my God, I'm always one of those who's very deeply skeptical about taking models from one place to another and implementing them. But of course, there's a lot of shared knowledge and understanding which needs to be built on. And I think there's a lot of really interesting work here, which could be of interest to other global Southern countries. And that having that global South-South conversation, I think in inclusive education is so important and essential. So on the screen, I've provided a slide, which basically is one of the things that my research group has been working on, is really trying to understand how to develop inclusive, equitable, quality education systems. There are lots of different models, et cetera, but I think we conceptualize it in what we call the 3 R's: rights, resources, research. The model is very rich, so I'm not going to try and cover all things, but I'm just going to give you examples from other countries of where some things have emerged within this model that are useful to think about. Okay, So rights, when we're thinking about the 3 R's, we start with, for instance, that they're all interconnected. They all provide some useful ideas for moving the field forward. They take a more systems-based approach to change. So in relation to rights, there's some really interesting work happening in relation to using the Washington Group questions as part of EMIS, the Education Management Information Systems. And there's some really interesting work going on in Fiji in relation to this. So a really interesting model to look at for Pakistan if they're wanting to continue to think about using these models in great detail. Within the country context, I mean, we did some work with ITA and introduced Washington questions in the USER survey. And that provided some really fantastic insights into the notion of the right to engage with the curriculum and community. What we found, yes, the right to education was being met, but learning outcomes for children was so poor. So really, we need to focus on understanding education and schooling holistically. And here is an interesting example again, which would be worth thinking about when we're thinking about improving the quality of education systems. The second R that I'm going to move on to is resources. And I had requested some links to be put in the chat. They are resources that people can, if you're interested, please do look at them. So in relation to what other models are available, there's a lot of focus on teacher training in most countries. And again, not surprising when we think about, how to make more inclusive systems, we'd say train our teachers better. But I think there's a lot to be done, say, for teacher support. Okay, and there's some really interesting examples of the use of interim teachers in Kenya and in India. We have the use of inclusive education resource centers in Ethiopia. And I think these are some really interesting examples that might be useful to really think more deeply what it means for Pakistan, how to support teachers. The other thing that I just say here very briefly is there's a new body of research which is emerging in relation to teachers with disabilities and working in mainstream schools. And that might be something really interesting to think about. So as we get more children with disabilities into school, one is how do we think of employment opportunities? And teaching is a profession which should be accessible. But also if we have teachers with disabilities in mainstream schools, which they do exist, believe me, they can also help build inclusive cultures. Okay, so really thinking about how to identify teachers with disabilities, what kind of a support systems would they need, because there'll be a ripple effect in the entire school in terms of building their school culture, but also being really important role models for communities surrounding schools and children without disabilities. And I think someone talked about notions of social stigma and how teachers with disabilities, when supported, can help address many of these issues. My last point is going to be on the research. And again, what could Pakistan realistically learn? Oh my God, I think you guys are ahead of the curve, and that's really powerful. What is really beautiful to see is that there's an acknowledgement of numbers, definitely. So data is really important, data sets are really important, but also there's a huge acknowledgement of narratives. It was really powerful to hear people talk about lived experiences, etc. And I think all that is really important. The big bridge will be now, how do you communicate this research to policymakers to influence policy? And indeed, how do you involve organizations of persons with disabilities and persons with disabilities themselves in really shaping the future agenda of research and also ensuring that there is impact? So yeah, so no one model, but I think there's some really interesting ideas across the board which could allow for greater conversation. So I'm going to stop here.
Thank you so much, Dr. Nidhi. I think there's so much to absorb and learn, but this is a wonderful slide. Thank you for sharing that. And this very naturally takes us to our next segment on policy implications. We have with us Ms. Ujala Sarfaraz. Ms. Ujala, based on what we have heard, what are the policy implications of the study's findings, and what opportunities emerge from this for strengthening the disability inclusive education at policy level in Pakistan?
Thank you so much, Dr. Sahar. And I think the first half of this webinar, including all the study findings as well as Dr. Saiba's insights just now, has set a strong foundation for discussions around the policy implications. Because even though different studies are highlighting different aspects of the challenges facing disability inclusion in education sector, some common patterns of policy challenges, learnings, and opportunities can be identified, and we have identified them through the policy briefs. So in this section of the webinar, I will talk about the key policy challenges and learnings that these studies are highlighting in terms of the effective disability inclusion in education sector policies, plans, and budgeting, and what opportunities then they present for the decision makers in education sector. So if we talk about the Pakistan legislative framework and the education policies at the principal level, a strong case for inclusive education commitments of the federal and provincial governments can very easily be made. For instance, the Constitution of Pakistan provides the right to free and compulsory education to all children, keyword being all children of Pakistan. Then if we look at the National Education Policy Development Framework, which was developed by the Ministry of Federal Education in 2024 for the provinces to then adopt, was drafted to address the educational disparities in Pakistan. Then the education sector plans, which are available for the provinces and which highlight education, provincial education departments' priorities for at least 5 years, and then are, updated every 5 years or so, are formulated on the principle of equity and inclusion. It is also important to note that to date, the government of Pakistan has executed global partnership for education supported programs worth approximately 400 million US dollars to transform education in Pakistan. And inclusion of children with disabilities in education is a key requirement of for a GPE supported projects according to their GPE strategy 2030. At the same time, it is important to note, and this is not something that I'm just saying, Dr. Sapana also mentioned, at the same time, Pakistan's adoption of the SDGs Agenda 2030 and the ratification of UN Convention on Rights Convention on Rights of Persons with Disability means that government of Pakistan has made a commitment to leave no one behind, especially when it comes to the provision of equal education to the children with disabilities. It is also a really good update that all the provinces and territories of Pakistan have passed disability acts with a strong component on inclusive education. Now, all of these examples that I presented is to say that principally the children with disabilities have a very strong claim on equal access to education according to the legislation of Pakistan. However, where we do fall short or where we still have a long way to go is the implementation of these policies and laws. So I'll present some examples of these challenges. For instance, governments of Punjab and Sindh have taken a very significant step to increase their school level budgetary allocation. However, the needs of children with disabilities still remain insufficiently addressed in that allocation. Similarly, inclusion of Washington Group short set question in annual school census is a welcome effort. However, the study one findings that Ittifaq presented also highlights that its meaningful impact on the policy decision is only possible through the challenges which he presented. For example, challenges of data standardization, addressing technical weaknesses, building stakeholder capacity, and increasing stakeholder awareness on disability. Finally, a key hindrance to effective inclusion of children with disabilities at the policy level are the challenges pertaining to interministerial and interdepartmental coordination and policy coherence. Study 3 and 4 presented by Dr. Sapana provide a best case study for this. So the implementation of the Pakistan School Safety Framework, which was developed by the National Disaster Management Authority, is only going to be effective if its provisions for children with disabilities are meaningfully incorporated into the education ecosystem, which means incorporating it into the education sector plans and the education budgeting of the provinces. And this requires very strong coordination efforts between the provincial education departments as well as the disaster management authorities. Now, the Can we go to the next slide? Thank you. Now, the opportunities that these study findings highlighted for the education departments and decision makers are plenty, but I will just mention the key ones, and they do tie in with what the previous presenters have also said. Number one, setting up the interministerial technical working groups. So that is one way to kind of strengthen the and address the interministerial coordination issues that and we do have good example of this in Pakistan. We do see that even the federal government and provincial governments have increasingly come together through these committees and technical working groups to address the intersectoral issues, policy issues, and different aspects. Then another key point, which Dr. Nidhi also mentioned, and everyone mentioned, in fact, was the meaningful participation of persons with disabilities, their representative organizations, as well as the parents of children with disabilities at the decision-making levels. For example, school management committees should have parents of children with disabilities represented as well, and this will allow increasing the awareness about the real disability issues and incorporating the lived experiences and issues that children with disabilities face. Additionally, continued training and capacity building of education sector stakeholders, starting with the teachers at school level. This is also key learning which has been presented. So overall, the federal and provincial governments of Pakistan are moving in the right direction. As you can see, the policy structure is there, but they do need continued commitment and dedication in achieving a truly inclusive education system at the policy level in Pakistan. I will stop here.
Thank you so much, Ms. Ujala. That is very reassuring once again to see the direction which things are moving at the policy level. And this brings us to the last segment. You mentioned lived experiences. So now we would like to hear from Mr. Mohammed Atif Sheikh. Thank you for joining us today for this webinar. Mr. Atif, bringing all these studies findings together, what do they actually mean for a child with a disability in Pakistan? And I'll connect the next question to it as well. What do all these findings mean for climate resilient, inclusive education in Pakistan? What is missing when we talk about inclusion from a research or policy lens? Yes, Mr. Atif, you are with us? Okay, I don't see him in the audience link, but Mr. Itfaq, if you could just find out if Mr. Atif is with us. I could see all the participants, but somehow I cannot spot him. I hope his connection.
Just let me check. Give me a
Sure,
sec, please.
sure. So while we wait for Mr. Atif, I know we have a long list of questions, and that's where we were moving towards next. So let's now start actually addressing some of the questions since we don't have enough time. Okay, so going back to the beginning.
Dr. Sahar, apologies for interruption. Atif is not able to unmute actually. He's online. So I think he's now able to unmute and we'll be speaking. Yeah.
All right.
Yeah,
and
thank
the
you,
video's on?
Yeah,
Thank
there
you so
were
much, Jen.
like these options of camera and mic were invisible. So now I can do it. Thank you.
Apologies for that. Thank you for joining us.
I was listening to every speaker very carefully. So when it was my turn, I looked at the buttons, they were invisible. So thank you very much, sir. And actually, I'm very much grateful to Sightsavers, Oxford Policy Management, their team, and UK International Development for these much needed studies. Like they were long awaited as well. Like most of the decisions in Pakistan have been related to disability inclusion have been taken on the conservative estimates or the information which was without evidence. So we were waiting for these researchers. They would bring some evidence-based information and talk about the data collection. So now at least we have some good studies. So let me, as my session, my slot is about sharing the lived experience of person with disabilities. So it's worth sharing my own experience very briefly. before commenting on the research studies. I was born with physical disability. And at that time, I went to a special education school, which was the first ever special education school established by the state in 1981. And I was the very first student of that system. So when I completed my primary education, until then, I was a special child because I was taken care by the physiotherapist, speech therapist, and educationist. And I was taken care by all the system of special education. But when I was in grade 6, I had to go to public mainstream school. And on the very first day, I realized that I have some, there's something wrong with me because children were bullying me, teachers started discrimination, and like the positive sense or the negative sense, both. Sometimes they over supported me that, oh, okay, don't worry, don't move, just sit there. You have some problems, so don't worry about it. And sometimes even the teacher were laughing at me that how will you write, your hands are not like that, other children. So these kind of experiences I've been facing in a grade 6 just after special education. One day, one of the teacher, that was the punishment at that time in 1986 was little common in public schools. One of the teacher punished all the students in the class for some reason. And when it was my turn, said that, oh, I will not punish you. You are a disabled person. You are a disabled child. The first year, that was the first year when I realized, when I heard that I am a disabled child. I have kind of a disability. So after a few moments, I started enjoying my disability because I thought that nobody can punish me now anymore. I am a disabled child. So I will be exempted from all the punishments. Then that was the day when I realized that what other people with disabilities are doing in Pakistan. Are they facing the same discrimination? Are they having the same lifestyle? What are the child? I was very young, but I started thinking about that barriers faced by all the children with disabilities in the mainstream schools or who are not going to school. So this was the very first thing which can be start of my career. And then by the time when I was graduated, I founded a group of people with disabilities who were my class fellows in the special education, and we started a self-help organization, which is now an established development organization run by people with disabilities and working for the last 27 years with UN agencies and international development partners as an advisory role in the government, technical communities and everywhere. But still, a lot of things need to be done. And these policies are not being implemented. These policies are not sensitized enough about disability because we don't have data. Children with disabilities are still uncounted population, uncounted children in Pakistan. As the Park has mentioned about the Washington group set of questions, we have trained Pakistan Bureau of Statistics on Washington group set of questions. We have translated in Urdu and given it to many data collection organizations, but still the training or the understanding of disability from the rights-based perspective, from the environmental perspective is missing. So very rightly, like these studies which have highlighted few points in the inclusive education system are critically important, particularly the missing data, the need of assistive technology, need of communication technology such as Pakistan Sign Language. The teaching methodologies need to be addressed, the pedagogical techniques and the teaching methodologies, particularly for intellectual disabilities, are totally missing. And lastly, or desensitization of teachers. When we talk about assistive technology and the environment make a critical role in mainstreaming children with disabilities in the school or education system, because special education schools are limited and they can't capture, or they will prepare special children which will not be ready to participate in the mainstream or go to the mainstream education. So we need to introduce adaptive technology at the local level which every child need to attend the classroom. It can be a hearing aid, or it can be a simple wheelchair according to the need of that child, or the infrastructure in the classroom and the toilets in the school. So assistive technology and the inclusive infrastructure can make a huge difference to bring children from their houses to the classroom. Secondly, one of the research mentioned about the Pakistan Sign Language. Unfortunately, the sign language has not been standardized yet. Some of the non-profit organizations have contributed a lot to develop the vocabulary for sign language, but the government of Pakistan has not accepted that vocabulary yet and not standardized. We have been struggling with National University of Modern Languages, with the National Institute of Special Education, and all the stakeholders to make a standardized Pakistan Sign language, which is still missing. And if we don't have language, how we can train the teacher? How we can create interpreters for that language? And children with disabilities will remain again out of the mainstream. And on the understanding of the disability from rights perspective is now very important, because teachers who are trained, even somebody had mentioned about the Open University Special Education Department, and then any other like special education trainings for the teacher, the aspect of understanding disability from environmental perspective is missing. Always they are being taught about impairments, the bodily limitations. They have never been taught about the limitation in the environment, the barriers which have been highlighted in these studies. They have never been taught about those barriers who limited who limit people with disabilities or children with disabilities to come out of their houses and to attend the mainstream school. And the last thing, the understanding of disability and collecting data can be effectively be improved if we engage organizations of people with disabilities. Pakistan is one of those countries who have a wider network of organizations led and run by people with disabilities themselves. And it started in the early 1970s, like when the Association of the Blind, Association of the Deaf were established. Now they are the cross disability organization. Around 70 plus cross disability organizations are existing at the district level. So if somehow we can provide this evidence in the research that organizations run by people with disabilities can be a good source to guide implementing partners, organizations, schools, and to understand how disability inclusion can be achieved at the grassroots level. So these are the few things. But plus, lastly, I would appreciate the recommendations given in these studies are literally doable. But again, we need some kind of understanding or training for the policymakers as well to understand the rights-based model of disabilities. We are in the transition from the marigold charity to a rights-based and social model of disabilities. But still at the policy level, people need training, all guidelines, and authentic resources that how to understand disability and implement or make education fully inclusive. I stop here. Thank you very much.
Thank you so much, Mr. Atif, for sharing your personal experiences. It's much appreciated, and you've learned so much about how relevant our work is and where we need to go. That we learned about the gaps, the difficulties. So just immediately trying to wrap up the webinar. I mean, there is so much to discuss, and we have a lot of queries. I'll just pose 2 or 3 very interesting or important questions that came up in the beginning. Just immediately, Dr. Julia, there's a question for your study. Could you please clarify how the children were identified during the study through school records, teacher observations, or head teacher's responses? And additionally, what percentage of such children did you find in mainstream schools? This is regarding your study and what you, so if you get, you can respond to this question quickly. We have a QR code as well, just before Dr. Julia responds. Please do share your feedback with us. And please, you can learn more about these studies through our blogs and reports based on the DARE RC website. So coming back to you, Dr. Julia.
Great. Thank you so much, Dr. Saha. And just to add, I'll be very happy to also respond to any further questions over email. If Etibat wants to send through details, I can certainly do that. In terms of how we identified the children for the qualitative study, we had a lot of discussions around possible approaches to doing this. And finally, what we did was we worked in collaboration with provincial education departments to look at the data actually collected through the annual school census. And we used that as a starting point, focusing on schools in particular areas where children with disabilities had been reported as present. But then we also needed to work in collaboration with those schools as data quality really wasn't great, and just ensure that those children were in fact present. We did rely very much on the judgment of the teachers and head teachers. I can't really speak to the percentage of children that we found in schools, as that wasn't really something we were trying to assess through the study. But obviously in our other study on the use of the Washington group questions, we do have some information on that, but as Itvak highlighted, there were so many data quality concerns that we would be really skeptical about relying on that data to assess the prevalence of disability in schools. I hope that covers everything. Thank you.
Thank you so much, Dr. Julie. Yes, I think that does respond to the query. Mr. Tafaq, is a question for your study. Why was it decided to use the Washington group questions rather than the child functioning module, and who was responding, the carers or the teachers? Would you like to respond?
Thank you very
this?
much. Yeah, very, very important question. So I'll keep it very brief. So first of all, the short set was used because it was part of the data standardization framework, which was developed by the Ministry of Federal Education and Professional Training. And that framework actually guides the annual school census. And that is why this short set was included in as a part of the census. However, I mean, it would be really difficult to respond on behalf of the ministry, but I can definitely respond based on what I know, that the Washington group short set is actually a very brief with only 6 questions, and it takes less time. It is basically easier to use, though it also have a criticism of under reporting the prevalence of disabilities, but it is easy, short, and can be easily used. The responses were ideally, I mean, as per guidance, the responses was supposed to come from the classroom teachers who have an regular interaction with the child. But as we have noted in the study that, different schools used different distinct approaches to the generation of the data, but guidance says that it should come from the classroom teacher. I hope that answers the question.
Thank you so much for sharing that response, Tafaq sir. Dr. Sapana, just quickly, how were children screened for learning difficulties in your study? Would you like to respond to that question?
Yeah,
I know
sure.
we have gone beyond time, but yeah.
Okay, briefly, we went to special, because the mainstream schools we went to did not have many children with disabilities, that they were enrolled but not were present at schools, that we had to include 2 special education schools in our study, and both schools were from Islamabad. And we purposively selected, made sure that learners with all types with disabilities were participant in the study. So learners with disability were also included, but it was selected by the school teacher and head teachers. That's how they were selected, not by us.
Thank you, Dr. Julia. Dr. Sana, I know you have to sign off. If you could just quickly respond to this question. Is the AI-powered platform using an avatar for the PSL version, or is it preloaded with a human interpreter? I know that as AI platforms of sign language use avatars in India and Kenya, and which are not clear enough for use of a good level of the sign language. Very interested to see how this was developed. Would you like to respond?
Yeah, thank you, Dr. Shah. This was one of the major concerns when we started envisioning this system with the deaf schools, and both the schools came out upfront that they don't need an avatar to be shown as a sign language interpreter, and they wanted a human a person over there. So from the very on, from the very start of the project, we had this design in mind, and yes, the it's a human interpreter showing sign language at the moment, and it's not an avatar. So the short answer is yes, it's not an avatar. It's a yeah, human person shown.
Thank you, Dr. Sana, for that quick response. Dr. Nidhi, just one question for you. I want to know, what are the criteria to become an inclusive school? There is no specific criteria and measure, and many book talks. We also read your article on international perspective and interpretation. Would you like to respond to this question? Yeah.
I'll make it very quick, Sahar. I know we're short on time. There is no quick answer, like a simple line as a definition to inclusive education. What I always say, and I've been doing a lot of work in this area, is there's certain principles that we all agree to. And those principles will determine how inclusive education looks like in each country context and how an inclusive school. For me, it's not an issue just simply about location. It's literally what I said earlier. It's about entry, making sure it's in inclusive school is which is available, accessible to all children. It's about engagement. Everyone should be part of the formal and the informal curriculum within the school and the classroom. And it's about empowerment, ensuring that all the children are getting something out of education, which is beyond just simply good learning outcomes, which are really essential, but not enough. So if we adhere to certain principles, we can define what a model of inclusive school would look like.
Thank you so much, Dr. Nidhi. I think that responds to the question really well. Dr. Sana, just one more question. There are a number of them directed to your study. I'll just select one. So are hearing impaired children in Sindh and KPK following PSL in schools? I wonder if you would like to respond to this question. And the other one is, how can we define authenticity and standardization of PSL? So pick up a question that you would like to respond to. Yeah.
I can respond to both, but let's pick up the later one. And I would like to just mention that Dr. Atif Saab just mentioned about the sign language standardization issue already when he was sharing experiences. That unfortunately, Pakistan Sign Language has not been standardized as yet. We can't comment on its authenticity because it's a language. And if you talk to the deaf community and the deaf schools, they own it up very seriously, and there could be variations across signs that exist between the both languages, which are called sign language at both schools, with a little bit of variation, but it as we don't have a policy as yet for standardization or a standardized language for the entire country, so I mean, once that we don't have that in place, so we can't really comment if which one is right and which one is not, because they've been using it for many years and the others have been using it for many years. So yeah, unless the standardization takes place, only then the signs can be similar across all the variations that are being used at different places. Right.
Thank you so much, Dr. Sana. That's very helpful. So we will be signing off now. We have gone beyond the ending time of the webinar, and we know there are many other questions. So it would be nice to share your questions with us, even post the webinar via our feedback form, and we will direct them towards the targeted speakers. But thank you so much to all our esteemed panelists for taking out time to share your knowledge, your insights, your experiences, your studies findings. If all of you could just turn on your video for once, it would be nice, so that we could just, bid farewell to our audience who have been very patient, very engaged. Thank you so much, everyone, for making this an informative session. We've learned so much. Atif Saab, it was wonderful having you here. Dr. Nidhi, Ujala, Dr. Sana, Itafaq Saab, Dr. Julia, Dr. Sapana, well done on all the wonderful work you're doing. And it's been so informative for me. I've really enjoyed this. I would like to learn more about inclusive education. and may the good work continue. And Dr. Nasima, of course, thank you for joining in. Sorry, I skipped you earlier. But yes, so dear audience, I'm so sorry we could not take all the questions, but we have them in our chat box, and you know, you can share more of them with us via the feedback form. There's a space over there. Thank you, Dr. Nidhi. It was a pleasure. Thank you so much. So take care, everyone. Have a nice day. And yes,
Thank
see
you
you
to
soon.